Hello, Dr. Anish Shah and I will be talking today. My name is Maureen Merrill. I'm a psychologist and performance coach who works on Dr. Shah's team. He is a psychiatrist and the head of Siyan Clinical in Santa Rosa, California. He's also, however, developed an intense interest in public health. So the stress symptoms he's been seeing in his patients, he's translated that into what it means for all of us and our social responses to the crises we have. What drives you to integrate these areas of expertise? How did you begin to see the connections and bring them into your home base as a psychiatrist?
Thank you, Maureen. That's a good question. And it all goes back to my work in my medical school and internship training in India. I saw a lot of cases of tuberculosis, measles, mumps, rubella, tetanus, even polio, and many of this illness could be prevented by a vaccine. And we did a lot of work back then regarding educating public about vaccine and this various disease state. And I have also seen a lot of families suffering from this chronic viral as well as bacterial illnesses, which could simply be prevented by taking vaccine. And that really intrigued my interest in primary prevention. When I say primary prevention, I meant that we prevent a disease state before it ever happens. Our system, healthcare system in the United States and globally are more geared towards secondary and tertiary prevention methodology. That means when we have a disease, when we get sick, we get treatment. When we get complications, we get treatment. But we seldom think about how to prevent disease. And that has been my core interest in mental health, preventing mental health illnesses through primary prevention strategies and also in general disease state. So when the COVID vaccine came, it automatically intrigued my interest and invigorated in just working something along the line. So we can just look into getting a fair control about the pandemic and the herd immunity that we all are been wishing to have it for now quite a long time.
Yeah, we definitely want to learn more about how that is working. And you've mentioned that 2020 saw an enormous spike in mental health issues. I know you've been extremely busy in your practice with this. Why is that exactly? And what kinds of issues are you seeing in particular here in the North Bay?
Maureen, 2020 has been one of the most difficult year globally in United States and also in North Bay. As you can imagine, the pandemic and pandemic related psychosocial sequelae has impacted a lot from the mental health perspective. We have had shelter at home, closure of school, economic impact, healthcare impact. Our social paradigm just changed completely in 2020. And on top of that, in 2020, we had election. We also have civil unrest movement with Black Lives movements and many other things that has happened. Particularly in North Bay, we have had at least 2 to 3 small episodes of wildfire related to various natural causes, So I think it's been a tough time in North Bay in 2020, to say the least.
A lot of trauma, I guess. And you've talked about pandemic fatigue, and I think that resonates. But I think on the face of it, first thing I thought was, it just means I'm so over all of this. I'm really tired of this. I'm tired of the restrictions and the worry and the upheaval. But now I'm understanding from talking to you that it's more about our reaction to the ongoing stress. So pandemic fatigue is it a syndrome, or how does it work?
A good question, Maureen. And we all are experiencing pandemic fatigue at this time. So basically, what it is a state of being worn out by the recommendations and precautions and restriction related to pandemic, thereby leading one to abandon all the precautions and social distancing norm that have been laid out by public health authorities. And then we all experience a typical mindset, which I call mental health or pandemic fatigue. It's a typical set of symptoms that one develops. And when that happens, viral behavior increases, and then we end up having more damages. And some of the symptoms one experience when they experience pandemic fatigue is they have trouble focusing, feeling of helplessness, sleep problem, being withdrawn from others, racing thoughts, and easily snapping or becoming arguing or irritable. These are some of the typical symptoms of pandemic fatigue that we see in individuals and in our patients and in society in general at this stage of pandemic right now, Maureen.
Huh. You mentioned racing thoughts. Is that when you're trying to get to sleep and you can't stop thinking? Is that a daytime thing or both?
Right, a good question. Racing thought typically means that your mind kind of wanders. It goes from one thought to another thought, and sometimes we all have worries about one thing or other thing. When our thoughts race, they just kind of run many miles an hour, many miles a minute, and one just shifts from one thoughts to another thoughts to the another thoughts, and it's sort of a state of a worry horde. It's state where we are not able to stay in a tranquil or a peaceful state of mind.
Okay. I was looking at some notes from a conversation we had about a year ago, and of course we just barely heard of COVID, but the fires had happened in the North Bay. People were evacuated and there was a lot of worry. And even back then, you were talking about the widespread stresses and the effects on people, families, workers, jobs, and you were observing stress effects from the fires. And we're not getting our usual rituals and routines that help us cope with stress. So what do we do?
Well, a good question, and it all leads to my initial thought that I had said in this interview about primary prevention, catching up issues earlier and taking proactive actions. And I'm going to tell you few very simple strategies that can help someone develop or prevent someone from developing a mental illness or a psychiatric syndromes. And first of all, watch out your physical health. Diet, nutrition, sleep, and exercise. 4 domain of your physical health. Very important. Please pledge to take an action on all these 4 elements. Limit your news intake. No more than 1 hour, and always try to use reputable source for information. There is a lot of disinformation going on right now, and that is a cause of major stress, general stress, and also in times a psychiatric syndromes such as major clinical depression or anxiety disorders. Try to pursue activities that would lower your stress. Yoga, breathing, maybe participating into some joy producing activities or your hobbies that you always liked, enjoying a comedy show. Nature is also a very healing element in one's ability to lower the stress. Try to do something that lowers the stress is the third thing. Connect with others, even if you are not able to meet send some notes, speak to people online, participate in discussion groups which are healthier, meet with your family, friends with virtual different methods, try to avoid isolation is what I'm trying to drive. And when you have a feeling, when you have a feeling which are sad, which are depressing, anxiety provoking, when that sense of helplessness develops, I say focus on what you can do to better. I accept that feeling. Be kind to yourself about having those feelings, and then see there is a thing or two you can do to shake off those negative thoughts or feelings, And I will always say take COVID precautions. COVID precautions not only help you safeguard mental health, physical health, I meant, but also mental health. So those are some of the very basic strategies that I would ask that listeners consider following through to prevent a major mental health issues through this pandemic.
Mhm. So even people who are normally following good health practices could be experiencing that stress. And it seems to me the lack of usual comforts and refreshments and things that we do in our routines that comfort us are not as available to us as they were.
Right, correct.
May I ask you personally, have you noticed anything in yourself like losing focus or thoughts racing? That I have. I definitely have found myself not as focused. And I do notice that what you said about the news is so true that I hadn't thought of it. Being a junkie, it actually does sort of bring me down if I have too much of it. Have you noticed that among yourself or your family and friends?
Well, I see this all the time among my patients, all this impact of news and excessive use of social media, especially the disinformation through WhatsApp, trying to go to a source which is not reliable, and excessive attachment to what is going on around us, to an extent that it is not an information for our well-being, but it's just an obsession that one developed. And when that happens, I have seen patients, I have seen family members losing their sleep, losing their focus. Frankly, I have been through that journey myself too when the pandemic came in March and April, when there was so much to learn, so much to know, and so much was unknown. I was looking at various resources throughout the day, and it kind of, after a couple of weeks, I kind of felt that fatigue, and I kind of felt that my focus was wearing off for those 2 weeks. So that happens to normal people, when you have excessive connection or excessive use of your time in exploring various social media, news and informations,
Right.
And when the disinformation, misinformation adds to those, then it becomes really a big tragedy.
Dr. Shah, you mentioned there's hope. Tell us about the hope. Why should we have it? What have we got to believe in and hope for now?
The biggest hope that we got in 2020 in the last month was the COVID-19 vaccine. And that is a huge gift that came on our way from scientific community. Kudos to all of them who developed this vaccine in record time. We have now 2 emergency use authorized vaccine from Pfizer, BioNTech, and Moderna. And these vaccines are really the gift that we got it in 2020. They prevent the serious COVID infections, and that is also the right step in the direction of getting the herd immunity, meaning that 70 to 75% of our population getting immunized with the vaccine, and then this virus, this pathogen, no longer is the public health issues that we all have had a struggle in 2020. So I think the vaccine has been the biggest hope that I see in 2021.
I'm really interested in the 1, 2, 3 on the vaccines. What do I really need to know as a non-medical person, and what should I be looking out for and mainly be aware of?
So the first time a person is infected with the virus, uh, it takes several days to weeks for our body to sort of get all the germ fighting tool to get rid of the infections. And after we get rid of the infection, our immune systems remembers how we fought, and we have memory T lymphocytes, we have antibodies, B lymphocytes, and that helps us protect from getting another bouts of infection in near future. Now, COVID-19 vaccine help our body develop the immunity to the virus. And there are several vaccines. Some are mRNA vaccines, some are vaccines made up of inactivated viral components. And what all they do is supply our body with memory T lymphocytes, B lymphocytes, and then our body remembers how to fight this virus in the future. It typically takes few weeks for the body to produce the T lymphocytes and B lymphocytes after we receive vaccination. Therefore, it is possible that a person could be infected with the virus that caused COVID-19 just before or just after vaccination, and then they get sick because the vaccine did not have enough time to provide protections. So that possibility also is there when you are using vaccine.
That's a new word to me, lymphocytes. Lymphocytes. So that's something that we develop in order to fight the disease or the infection.
Right. I mean, in a late term, we can say these are the soldiers. This is our immunity blocks. You know, they fight us. They help us fight an infection.
Okay. So can you assure me that I shouldn't have reluctance or doubts about getting a vaccine? Is there anything I should have any doubts about?
First of all, let me assure you that both Pfizer and Moderna vaccine, for which we have a EUE, they have done a phenomenal job with a placebo-controlled trial. Pfizer had 43,000 participants. Moderna had about 30,000 participants before we got EUA. And then the second part is, if you look at the side effects profile after vaccinations, they are very mild. The common issues are pain at the injection site, a little bit of a headache, low-grade fever, malaise, and things of that nature. You know, some people have a little bit of a nausea, GI disturbances. One of the most scariest things some people experience is when they get fever, but one has to remember that fever is a normal symptoms when our body is developing immunity. So it's nothing to worry about that piece. And the other part is, these vaccines are 90 to 95% effective. They have an excellent efficacy data. So those are the two very, very reassuring aspects about the vaccine.
So if I have those symptoms, can I expect them to go away fairly quickly?
Well, yes, most definitely. Just to share you my experience, when I took my vaccine, my symptoms went away in 24 hours. I had a little pain at my injection site. I had a mild headache. Within 24 hours, everything was gone for me. Some of my colleagues, some of the other Patients have reported symptoms until 2 or 3 days, but they usually go away. Now, keep in mind, there is also a little bit of a concern in media, and some patients have that worries too about having severe allergic reactions. But one has to understand that these allergic reactions are very common when you take medication like penicillin, when you take medication like sulfur drugs, other vaccines, even that happens sometime with flu vaccines, and we have a treatment for that. These allergic reactions can be treated very safely with the medication and other therapeutics that we have available right now. Moreover, the vaccines protocol currently asks us to monitor patient for 15 minutes after they get vaccine. So if they were to have any severe allergic reaction, which we call as the severest form being an anaphylaxis, we can do something to treat them right there and then.
Okay. So even a severe reaction is something that's not new and can be treated with usual methods.
That's correct. That's correct. Yes.
Now, after I get the vaccine, do I still need to wear a mask and distance from other people? And what if my whole family or my whole office is vaccinated? Can we dispense with the protocols or what?
And that's a good question, Maureen. And I get asked all the time, do we need to social distance after vaccines? My question is yes. And here is the reason why. First, both the vaccines have 2 doses. Pfizer has both the doses that needs to be given with 3 weeks apart. Moderna has the protocol of having 2 doses 4 weeks apart. So it takes time for our body to develop immunity. It doesn't happen right away after one takes the vaccine. The second aspect which we need to know, which we need to learn more, and we'll learn eventually with more and more data at our disposal about the transmissibility and vaccines. We don't know as yet whether the vaccine prevents transmission of virus from one individual to another individual. And to just elaborate that a little bit more, when we get vaccine, we develop antibody, and some of the antibodies reaches to our nasal mucosa, and they kind of stand guard there, and they kind of help prevent infections they kind of prevent the severe infection. We don't know as yet if that antibody pool in nasal mucosa is enough to prevent viral transmission from one individual to another if they sneeze, they cough, or they have a laborious breathing. So those parts are still unknown, and hence I'll say all my listeners, everyone, that we still have a little while to go with the mask, social distancing, even with vaccine.
So what kind of conditions need to be present before we can take our masks off and relate normally?
Well, all scientific community is rooting for that herd immunity that we are all longing for. What it means is when we have 70-75% of our population immunized with vaccines, then this virus no longer is a problem, at least the public health problem for us. I see some of the norms of that we have right now sort of rescinding at that point, but we still have a long ways to go before that.
Oh boy, I was hoping you had better news, but it's still not bad.
Yes.
You've talked about this light at the end of the tunnel, which is about hope. And I'm wondering if that hope and optimism helps with the personal stress and for public health overall. At least we know that there is a light. I heard a little saying that if you see the light at the end of the tunnel, it reminds you you're still in the tunnel. But
yes,
what effect does that have?
Yeah, that's correct. And it's a tunnel, and unfortunately, it's a long tunnel, but yes, there is a light at the end of the tunnel, and that's what we all are hoping into 2021. I say to everyone, the hope, the optimism, the kindness, and staying positive, and having that ability to look through shades of gray are one of the biggest protective factor when it comes to COVID-19 pandemic and mental illness. So if you have those traits, if you develop those traits, and if you work towards it, you are definitely going to do well with this pandemic and the road ahead in this long tunnel.
It sounds as if you think maybe we're going to learn from this in ways that'll be valuable regardless of whether there's crises happening. Of course, maybe there's always a crisis.
Right. Yeah, it's been a learning journey for all of us. Our perspective about healthcare, our perspective about relationship, and many positive things have come up from this crisis among ourselves here and globally.
Yes. Well, as I mentioned, we're going to show a slide with your contact information, and everyone should note that your website, Siyan Clinical, has links to your various articles and the tips that you've developed for dealing with pandemic fatigue and pandemic related stress, and also signs to watch out for when you need professional help and so on. I must ask you though, this silver lining, that the learning that we just talked about a little bit, that what silver lining or overall social good do you see can come from coming through this? Whatever looked so devastating and everything we've been through as a community. No, I mean, obviously the end of it, we'll feel good about the end of it, but something of value that we might be able to carry forward into our lives beyond it.
Well, the silver lining, the most important one is we'll get rid of this pandemic in 2021. This all will go away, and there is a light at the end of the tunnel, and that's my optimism in 2021 moving forward. However, until that time, I would tell all listeners that you stay safe, you stay healthy. COVID precautions and social distancing are difficult as a result of pandemic fatigue that we just discussed in this show, but I guess that's still an effective preventive strategies to curb this pandemic. And I urge everyone that please look out for the vaccine and take it as soon as it is available to you. Please call your primary care physician. Please call your local public health department to find out how you could get access to the vaccines in the upcoming weeks. And that is going to be the ultimate strategy that's going to help us move forward in 2021.
I think that calls to mind the issue that I really have to reach out to find the vaccine if I'm not in the medical profession directly and not a frontline worker. So I need to connect with my provider to see where I can get it, right?
Yes, that's correct. Yes.
They're not coming to me.
Yeah.
To go to okay, got it. Good advice for any time of life, I'm sure. So thank you, Dr. Shah. Another enlightening session. It's been therapeutic for me, actually, and I think it's been helpful to everyone. Thank you so much. We're looking forward to seeing more information through these links that we're showing. And I really mean this, Dr. Shah. You take care.
Thank you, Maureen. You take care too.